I do want to welcome you to today's Pacific Southwest Mental Health Technology Transfer Center webinar on building skills for cross-cultural communication and resilience during COVID-19. Just our standard reminder that although we are funded by the Substance Abuse and Mental Health Services Administration, that the content of these sessions may not necessarily reflect the views of SAMHSA or the views of the Department of Health and Human Services. So in case you're not familiar with the Pacific Southwest MHTTC, we are part of a national network of technology transfer centers, and we serve SAMHSA's Region 9, which includes the US Pacific Islands, Hawaii, Arizona, Nevada, and California. So the map on your screen, you'll see each region has a few different colored boxes. The blue boxes are the addiction TTCs, the green boxes are the prevention TTCs, and the orange boxes, which include our center, those are the mental health TTCs. So it looks like, as many of you noted in the chat box, not everyone is from Region 9, and that is A-OK. We are delighted to have you here with us. However, if you haven't yet connected with your specific region and you would like to do so, please feel free just to reach out to us, let us know. We're happy to make that connection. There will also be a link in the follow-up email that will go out after today's webinar that will include a link to help locate your specific region's center. So our role at the Pacific Southwest MHTTC is to provide you with training and technical assistance and resources to support the mental health and the school mental health workforce in our region, to adopt and implement evidence-based practices across the mental health continuum of care. And this is just an overview of our services. We offer no-cost support to the field through webinars like this one we're on today, as well as through coaching, consultation, resources and tools, virtual trainings, and then hopefully soon our on-site events will continue. So that's just a little bit about our center, who we are and what we do. And then with that, I'm going to go ahead and turn it over to our wonderful presenter, Joel Jackson, to introduce himself and get us started. Hi, Joel.
Hello everyone, and thank you for joining us for today's webinar. My name is Joel Jackson, and I formally serve as the Assistant Director of Inclusion and Training for the Urban Health Initiative's Office of Diversity, Inclusion, and Equity at UChicago Medicine. I've worked at this organization for the past 6 years, but have worked in the field of healthcare for the past 20 years. While in addition serving as a trainer around topics such as cultural competence, social justice, and leadership development. So again, thank you for joining me for today's discussion. Just to share with you the agenda quickly. First, I'm going to go over some norms and our objectives. I'm going to share with you a theory piece called The Ladder of Cultural Competence. I'll lead you in a guided visualization exercise. I'm going to briefly spend a small lecturette discussing worldview and the cycle of socialization. We will watch a video that comes from A Natural Causes. It's a small clip called Place Matters. We're actually going to watch a snippet of the Place Matters video. And then I will go over the CLARA method, which is a method of cross-cultural communication, and then allow you some time to practice using the method on the individual level regarding a situation or scenario that you would like to apply the method to. And then, of course, at the end, I will address any questions that you may have, or any comments that you may share on behalf of the whole group or for the betterment of the whole group. And let's begin. So our objectives today, we're going to describe the ladder of cultural competence, identify how our biases and lived experiences may influence our perception of self and others, and practice the CLARA method for cross-cultural communication. Before we get started, I would like to use this acronym called PRIDE to serve as our operating agreement or expectations as we communicate with each other today. So first, I ask that everyone dedicate to participation, which just really means do your best to eliminate distractions. We always have things that are going on in our environments, but if you could just try your best to stay present and focus on the topics that we will be discussing. R is for respect, so I ask that you actively listen and also trust the process. Try to stick with me until the end. I is for integrity, and so for integrity, I ask that you assume best intentions, which means if someone says something that does not vibe very well with you, try to assume that they did not intend to cause any harm, and that can help with the dialogue. D is for diversity, and so I invite you to all work on suspending judgment. Judgment is something that we all do. We can't find our way around within the world without judging differences in directions and colors and things like that. At the same time, when we have opportunities like this, we can use our filters. And I always say that what comes up does not have to come out. We can be intentional about what we say. Okay, and then lastly, E is for excellence, which I ask that you, for excellence, sort of gently lean into discomfort. When we're in our comfort zones, there's nothing pressing us to learn anything new. At the same time, through this presentation, I will give you information, hopefully broaden your awareness, and you will actually take action in practicing a tool that will hopefully stretch you away from your comfort zone to rest snugly at what we like to call the learning edge. The purpose of this operating agreement is to sort of build a container around the experience so that no one feels fear or threat. Because when I feel fear or threat, I naturally retreat back to my comfort zone where no new learning can take place. So that is why, for excellence, I ask that you sort of gently lean into discomfort. Okay. So first, let's go over the ladder of cultural competence. Sometimes when the term cultural competence is used, there's a tendency to want to focus on others. For example, what can I learn about this cultural group or this identity group or this religious perspective to better work with people from this perspective? Well, I think that it is actually more important to start with self. So the first rung of the ladder is about awareness. And as you can see, it states develop a self-awareness, own our assumptions, values, and biases about human behavior. What that means is I have to introspectively think about what has influenced my belief system over my lifetime. For example, what did I learn from my family or my parents or guardians who are my first best teachers? What did I hear my grandparents say, whether I agreed with them or not? When I interact with the media, from the movies that I attend, the TV shows that I watch, the articles that I read, even the lyrics in the music that I listen to, how does that impact my interactions with people whom I have similarities with and my interactions with people with whom I have differences with? When I think about my education system, whenever I took a history class, whose story did I hear? Did I ever hear her story, for example? And were there certain he's who had the benefit to telling their story? The second rung of the ladder is focused on worldview. And it states understand our worldview as well as the worldview of culturally diverse patients and coworkers. What that means is that every one of us has our own way of making sense of the world. And so with about 205 of us on this webinar, that means that there are 205 different opinions about how the world works. If that's the case, then every interaction that you encounter is a cross-cultural interaction. That means that we may not always agree 100% with our family members, with our best and closest friends, or even with our partners or spouses, because we all make sense of the world differently, which is a different way of thinking about cultural competence today. And the way that I think of cultural competence, it kind of includes cultural humility, meaning that I will not know everything about every culture and have the humility to be open to learning. Therefore, one of the reasons that I use the term cultural competence because it's possible to focus on skills, which is the third rung of the ladder. And as you can see, it says develop appropriate interventions and techniques. That means that we can actually practice skills so that regardless of the background of the individual I'm encountering, I can still have a quality interaction with this person. Um, and especially since we all live in a cross-cultural environment, differences are definitely going to occur. So it's important for us to practice skills, cross-cultural communication skills. You know, the CLARE method is the skill that I will focus on today. Other methods are, for example, the teach back method, right? Which helps me to make sure that I've communicated in a manner in which the other person understands by checking to make sure that I've communicated appropriately, by simply asking them to share back something that they heard me say or what I asked them to do. The fourth rung of the ladder is focused on systems. And as you can see, it states, understand the institutional forces that support or negate cultural competence. What that means is I have to sort of analyze the things in the world that still have an influence on the way that I do my job and the way that I work with others, though I may not have direct control in order to change these things. So paying attention to everything from organizational policies and expectations in terms of standards, but also how the issues of racism, sexism, classism, and all forms of oppression may have an impact on my interactions with clients or patients. So for example, if I am in a clinical role and I'm in a hospital and I'm trying to work with a patient about changing their diet, I may need to ask them some questions. I may need to ask them what are their thoughts about the illnesses that they have and how do they expect to be treated. I may need to ask them if there are culturally specific foods that they eat on a regular basis. And even if I don't have the time to spend with them on thinking about how to make it healthier, perhaps I can refer them to someone because we all work in a multidisciplinary system of care. Maybe it's a reference to a nutritionist who can spend time working with the individual to maybe change some of the ingredients that they use in their culturally specific foods. I might also need to ask them how they will access a quality grocery store. You know, with all of the civil unrest that just happened with the protests and riots and things like that that happened all across the country, many stores have shut down and may not return, which has increased the number of food deserts within our country and in our cities. A food desert is any situation where a person has to travel more than a mile to get to a quality grocery store. Because if they do, that is a food desert. So if I'm working with a patient and I'm asking them how they'll be able to meet their home health routines as it relates to their diet, I may need to ask them, you know, how can they travel or where will they go to access these quality foods? Because then maybe a referral to a social worker may be necessary so that that individual can work with that client or patient to connect them to social service programs that can better help meet their needs. And as you can see, these arrows on the ladder represent the fact that we are working on all four levels of this ladder of cultural competence at the same time. And it takes intentionality in order for us to do it. So next, what I'd like to do is lead you into a guided visualization exercise. I invite you to sit comfortably wherever you are, or if you're standing, just try your best to focus and pay attention to the words that I'm saying. I also invite you to close your eyes and listen to me as I speak. Try your best to clear your mind. What I'm going to do is describe several individuals for you. What I want you to do is imagine the individuals I'll be describing. And I encourage you to conjure up as detailed and textured of an image as possible for each individual, as much as you can. Try to include their physical characteristics, how they're dressed, their setting, and their context. After the initial description, I will add additional information for each person. Allow the mental image to develop in your mind. The first person that I want you to imagine is a female lawyer. So think about her. Who is she? How is she dressed? Where is she going? How does she normally get around? Now imagine that this female lawyer is also American Indian. This female lawyer, who's American Indian, is part of the Chippewa Nation. Monitor your image. Notice if there were any shifts. This female lawyer, who's American Indian and part of the Chippewa Nation, is 64 years old. This female lawyer, who's American Indian, part of the Chippewa Nation, and 64 years old, works for a multinational corporation. The next person that I want you to imagine is a gay man. So again, think about him. Who is he? How is he dressed? Where is he going? How does he get around? And imagine that this gay man is also of Japanese ancestry. Monitor your image. Notice if there were any shifts. This gay man of Japanese ancestry is also the father of two. What do you think his life is like at home? Or what do you think his life is like at work? This gay man of Japanese ancestry, who's the father of two, just celebrated his 82nd birthday. Again, monitor the image. Notice if there were any shifts. The next person that I want you to imagine is an African American woman. So again, think about her. Who is she? How is she dressed? Where is she going? How does she get there? Now imagine that this African American woman is also a single mother. What do you think her life is like at home? What is her life like at work? This African American woman, who's a single mother, is also extremely wealthy. Monitor your image. Notice if there were any shifts. This African American woman, who's a single mother and extremely wealthy, serves as the chief of cardiology at the University of California in San Francisco. The next person that I want you to imagine is a white man. So just like before, think about him. Who is he? How is he dressed? Where is he going? How does he get around? And imagine that this white man is also a world-class athlete. What is his life like at work? What is his life like at home? This white man, who's a world-class athlete, requires a wheelchair for mobility. Monitor your image. Notice if there were any shifts. This white man, who's a world-class athlete who requires a wheelchair for mobility, also owns and drives his own car. Again, monitor your image. Notice if there were any shifts. The next person I want you to imagine is an immigrant woman, an immigrant to the United States. So again, think about her. Who is she? How is she dressed? Where is she going? How does she get around? This immigrant woman is also a college student. What do you think her life is like at school, at home, or at work? This immigrant woman, who's a college student, comes to the United States from India. Monitor your image. Notice if there were any shifts. This immigrant woman, who's a college student from India, also identifies as an atheist. Monitor your image. Notice if there were any shifts. 2 more to go. The next person that I want you to imagine is a transgender man. So again, think about him. Who is he? How is he dressed? Where is he going? How does he get around? Now imagine that this transgender man is an engineer with a master's degree from Stanford. What do you think his life is like at work or at home? This transgender man, who's an engineer with a master's degree from Stanford, also identifies as Mexican American. Monitor the image. Notice if there were any shifts. This transgender man, who's an engineer with a master's degree from Stanford and identifies as Mexican American, is also 8 months pregnant. Monitor your image. Notice if there were any shifts. The last person that I want you to imagine is a white woman. So just like before, think about her. Who is she? How is she dressed? Where is she going? How does she get there? And imagine that this white woman was also diagnosed with bipolar disorder. This white woman diagnosed with bipolar disorder is also a hospital executive. What do you think her life is like at work or at home? This white woman, diagnosed with bipolar disorder, who's a hospital executive, recently got engaged to a woman. Again, monitor your image. Notice if there were any shifts. Okay, I invite you to reopen your eyes if you close them and join me back with the webinar. And next, what we're going to do is have a series of polling questions that will appear. What I want you to do is please answer them by clicking on the response for you. So for this one, you can click all that apply. What references did you use to come up with your mental images? Okay, as people are answering the poll, I can see that most people used an image of someone that they knew personally, which is usually what happens first when I do this exercise. Most people imagine someone that they know personally, that they imagine first. The second thing that people usually note is they also use references from someone with whom they may have had interactions with, but that they may not necessarily know personally. Another place that people go, as I can see about 45% of you, also use the reference of someone from the media. And about 20% of you were pretty unsure of where you gained your images from, which is a very natural part of this process as well. Most people, like I said, use a personal reference, and when they don't have someone in their personal life or with whom they've had interactions with, they go with the media. The caution about going with the media is that someone somewhere made a decision on what's going to be shown in the media. And even though we've come a long way from the past in terms of the media, there's a lot more diversity in terms of images that are shown. We still kind of have a long way to go. You know, a lot of imagery is either showing people living their lives in the laps of luxury or maybe down on the dumps and on Skid Row. There's not always a whole lot of variation in between there. In addition, oftentimes images in the media can be very stereotypical. At the same time, if you don't have interactions with someone in your lived experience, then we are left to rely on images that we gain from the media. All right, so let's try the next one. Yes or no, my final images were a significant shift from my initial images. Okay. People are still answering this polling question. The majority of us had a significant change from our initial image to our final image, which is somewhat to be expected, right? Um, what usually happens, sometimes what we do, especially if we are what I call do-gooders and who um, like to see the world through an empty slate, if you will. What we may do in the beginning is follow the exercise the way I explain it. And then after the first one or first couple of descriptions, when it gets to the third person, we try to control our images and try not to allow those stereotypical thoughts or images to come into our mind and try to create sort of just a blank person. Some of us may do that, you know, and then you may experience how difficult it is to do that because regardless of whether we believe some of the stereotypes that we were taught or that we heard in our lifetime, they still can have an impact on the way that we see and make sense of the world. Okay, we can go to the next polling question. So for this one, The question is, I had a tendency to think of someone my own age or younger unless an age was otherwise specified. And this is mainly in reference to the first two, which were the female lawyer who is Native American or American Indian, um, who is part of the Chippewa Nation and 64 years old and works for a multinational corporation. And then the second one was the gay man of Japanese ancestry, father of two, who just celebrated his 82nd birthday. And so almost half people, about 55%, said yes, they tend to think of someone their age or younger, and about 45% said no. And this is representative of what I usually see when I do this activity. About half of the people usually think of someone around their age range or younger, and then the other half kind of tries their best not to think of an age at all. But one thing is true, when I actually state an age, most of the time people think of someone, and if they were thinking of someone younger or their age, then that person ages for them in their imagery. Especially when it came to the gay man of Japanese ancestry who's the father of two and just celebrated his 82nd birthday. Not only did he age, but also his children in the story or the imagery ages as well. Okay, let's go to the next one. So, yes or no, I had a tendency to think of someone able bodied unless otherwise specified. And as the votes are coming in, the vast majority of us said yes, that we tend to think of someone able bodied. Um, and about 4%, a little more than 4%, said no. And this was true for me as well when I first participated in this exercise. Every individual I imagined was upwardly mobile, meaning that they weren't bound to a wheelchair or crutches or anything like that. And that's primarily because most of the people that I interact with are not bound to wheelchairs. And so, based on my lived experience, I only thought of someone in a wheelchair when it was actually expressed, which was the white man who was a world class athlete. Then I stated he requires a wheelchair for mobility and that he owns and drives his own car, which is definitely a possibility. If the person has enough resources, then they can perhaps, depending on their abilities while they're bound to the wheelchair, may still be able to access a car, of course, a customized vehicle, and then be able to drive it. Okay, let's go to the next. For this question, you can sort of enter answers. Which images were challenging or difficult for you to conjure? And I'll just sort of read through them again quickly. Female lawyer who was American Indian, part of the Chippewa Nation, 64 years old, and works for a multinational corporation. The gay man of Japanese ancestry, father of two, who just celebrated his 82nd birthday. The African American woman who was a single mother, extremely wealthy, and chief of cardiology at the University of California, San Francisco. The white man who is a world-class athlete, who requires a wheelchair for mobility and owns and drives his own car. the immigrant woman who was a college student from India who identifies as an atheist, the transgender man who's an engineer with a master's degree from Stanford, Mexican American, and 8 months pregnant. And lastly, the white woman who was diagnosed with bipolar disorder, who's a hospital executive and recently engaged to a woman. So I can see, and you all can see as well, the answers. I think you can. So as you can see, it's kind of across the board. Some people had no problems, and whereas many of us had some challenges with conjuring up images for different individuals. Especially, I see the transgender man who's pregnant was challenging for many individuals. A lot of organizations across the country are beginning to collect sexual orientation and gender identity demographic data on their patients. And hospitals are experiencing patients who identify as transgender men who are pregnant and do deliver birth. That may be important for an organization that offers those services to think about, because then naming or how things get named, name conventions within departments may need to be addressed. So instead of places like mother baby, then maybe it's labor and delivery instead, or thinking about other neutral terms like family birth center or things like that. Okay, we can go to the next one. This one, I had a tendency to think of someone of my race unless the race was otherwise specified. So it looks like so far the majority of people did not think of someone of their own race, and about 40% would think of someone of their own race unless otherwise specified. Now, all of these, the purpose of the polling questions really is we can't have a large group discussion. So I just wanted you to sort of self-reflect, right? Because all of this is just really data for you to think about. There is no right or wrong. I think it's important to just consider the fact that it is what it is. And it doesn't necessarily mean anything about you if you had a tendency to think one way versus another way as it pertains to these polling questions. And then the last one, not the last one, the second to the last one. This activity showed me that I have biases. Yes or no? So as the responses are coming in, a vast majority of people said yes, that this activity showed me that I have biases, about 93%, and about 7% of us said no. So again, just pay attention to that. The fact that if you always thought of someone able-bodied versus someone in a wheelchair, or if you always thought of someone of your race, unless otherwise specified, or if you always thought of someone your age or younger unless otherwise specified. Like I said before, it's not a good or a bad thing, it is what it is. Hopefully this activity showed you that actually we all have bias. And if we all have bias, it's somewhat permission giving. Now, I'm not saying you have my permission to be as biased as you want to. What I'm saying is, I don't have to beat myself up or be hard on myself because of the fact that I have bias. Because the reality is that all of us have bias. And bias is really just the way that I make sense of the world based on my very limited amount of experience living in the world. So it's impossible, really, for me not to have bias. Okay? And I think there's one more. And this is just really for us all to see the racial makeup of everyone who's a part of this presentation, who's attending the webinar. So how do I identify my race or ethnicity? And you can check the ones that apply for you. Or if only one applies, then you can check that. And again, this is really just for your own information and data. And it allows you to see the racial makeup of the individuals who've attended today's session. I appreciate so far everybody who has participated decided to disclose sort of confidentially their race. No one has declined to answer. And so as we can see, about 65% identify as white. And then you can see the smaller percentages, about 15% Latino or Hispanic, about almost 6% Asian, about 5% American Indian or Alaska Native, about 10% Black or African American, about 11% more than one race, and about 2% of us checked other, which means that these categories may not apply to you, or you may not see yourself represented in these categories, which I apologize for. I actually used these based on our census and what the census collects, even though they do distinguish between race and ethnicity. I find it's easier to have conversations when we think about ethnicity. At the same time, in our country, race means a lot in the United States. And I should say that's one of the delimitations of my presentation, that I will be focusing, and I am focusing, on how these issues manifest within the United States. That doesn't mean we can't have more of a global discussion. That's possible. But the dynamics of oppression that I focus on are based in this country. So thank you, everybody, for participating in the polling questions after that exercise. So one thing that you can try to do, which comes from Dr. Lisa Cooper, in terms of combating implicit bias, you can try to apply this acronym called RELATE. And I'll just read through it for all of us. So in terms of the R, it means respect. Respect the humanity of the person in front of you, regardless of whether you like them or agree with what they are saying. Empathize. I should say empathize. Imagine yourself in the other person's shoes. Listen. Try to listen more than you would talk. Ask yourself what assumptions you are making and whether they are based on facts about that particular person. And then lastly, T is for talk. Talk with patients or clients and coworkers about their personal lives, not just about medical problems or work. This can help with getting to know the person behind their visible or invisible identities, and helps with seeing the humanity and affirming the humanity in all of us. Oh, and lastly, engage. Engage patients and colleagues in decision making by asking their opinions. So let's talk a little bit about worldview. As I said earlier, it means the way you frame the world and what it means to you. The way you make sense of the world. So this could be one's conceptual framework, how you think the world works, or your philosophy of life. And how we develop our worldview has a lot to do with this cycle of socialization. When we're born into the world, culture already exists. So there's no shame, blame, or guilt on any of us because we did not create these systems of oppression and we did not create these dynamics. In fact, we didn't even get to choose our identities. We were born into the world and these mechanics were already at play and in place. And for most of us, our identities are fixed for the rest of our lives, though there are some areas where shifting is possible. As we're born into the world, then we become socialized. We're socialized by all of the many institutions that we interact with. First our family, our friends, and our peers, but also our education system, the media, healthcare system, the legal system, all of these different systems, and we're socialized according to the identities that we hold. And that's why all of us have our own way of making sense of the world. So let me share with you some personal examples of socialization. When I think of myself and male privilege, I can remember when I was in school, in high school and in college, that the male sports teams received more notoriety, attention, and resources than the female sports teams. This is an example of a reward that men received because of being male athletes, and an example of a sanction that women would receive as participating in female sports. I could also tell you a story about going into a mall and going shopping in a department store. One thing, a little fun fact about me is I like to wear glasses. I've always liked to wear glasses ever since I was a child, but I actually don't wear prescription glasses. Ever since I was about 4, my brother had his first pair of prescription glasses and only 2 years older than me. I always wanted to wear glasses to be somewhat like my brother. And so to this day, I still sometimes will wear glasses even though I don't have any on today. So I was in the store one time and I was just trying on glasses and I decided that I didn't want to buy any of them and I decided to walk out the store. As I walked out the store, the alarm system started to go off. And I stopped and turned around and everybody's attention, their eyes were all on me. Now, 2 things. If I were a thief, I wouldn't have stopped when the alarm went off and turned around and looked at everybody. I probably would have ran out the store and out the mall. But I'm not a thief. So I stopped and turned around and thought maybe this could be a teachable moment for somebody. The other thing is, I know my rights, and it's actually illegal for anyone to search me, even if I perhaps may have an item that they think that I've taken. But again, I thought this could be a teachable moment, so I turned around, and one of the associates in the store said, "Sir, please come back in. I need to look in your bag to make sure that you didn't take one of our items." At that very moment, as I started to walk back into the store, before I can even make it to the associate, another person walked back into the store from the other exit and said, "Excuse me, but I think you forgot to take the sensor off of one of my items." Now, I don't know what this individual's identities are, but I perceived her to be an older white woman. So apparently we both walked out the store at the exact same time. But when the alarm went off, everyone's attention was on me. So the sanction is the burden that I had to carry after that experience of wondering, what is it about me that made everybody assume that I had taken an item without paying for it? Is it because of my age? Is it because of my race? What is it? And think about that experience happening over and over and over again, not just in a department store, but also with other authorities, whether it's a medical professional that I feel like is not listening or ignoring part of what I'm trying to tell them in terms of my health, or the number of times that I've been pulled over by the police, not even while driving a car, but simply walking down the street to catch the bus. And if this happens repeatedly, time and time again, when it comes to an individual who has power or authority over me, then you can see how that may color the way that I make sense of the world. Versus the woman who walked back into the store who may felt comfortable bringing in her item and saying, "Hey, I think you forgot to take the sensor off of my item." If I were ever to walk out of a store with a sensor on my item, I'd probably be scared to come back in because of the stress that it would take for me to just have to prove my innocence. I would first probably try to find the receipt to make sure I have it in hand, ask if they have any footage so they can look at the cameras and all of this, which is unnecessary stress due to things like racial trauma. So, as we think about our current state of things, think about what narratives are being depicted. When we think about this year 2020 so far, so much has happened with COVID-19 and then all of the civil unrest that we've experienced across the country. This is giving an emerging mass activating collectively against all of these issues of oppression: racism, transphobia, misogyny, anti-Asian sentiment, especially when we think about COVID-19, homophobia, Islamophobia, anti-Semitism. It's also challenging comfortable notions of allyship and what does it mean to be an ally to each other. Fear and fatigue of what anti-racism and justice work might look like for you personally. And also fatigue experienced by historically marginalized people who have been living this all of their lives. Just to give you some quick examples in terms of COVID-19 stereotypes, racism and stereotypes towards Chinese and Asian Americans in terms of these terms that were used when COVID-19 when we were all becoming first aware of it. The Wuhan flu, or Asian disease, or Chinese coronavirus, and how many of my colleagues and allies who are of Asian descent felt the need to, and still feel the need, of course, to always have a mask on because of the stereotypes and the interactions that they were experiencing in this country. Another stereotype had to do with age. The pandemic was leading to an outbreak of age discrimination because the thought was that it would only impact our elders, and this term boomer remover was actually used a lot in media. In terms of disparities, COVID-19 actually very much illuminated how social determinants of health can have an impact where it caused mostly people of color and primarily African Americans to have fatal outcomes due to COVID-19 versus being able to recover and continue to live a quality of life. So COVID-19 related death is substantially higher amongst African American and Latinx communities. And social determinants of health differentially affect communities of color. For example, higher risk of comorbidities and prevalence. Prevalent health conditions like heart disease, diabetes, asthma, and hypertension. Some other disparities: communities of color also faced increased health risks associated with COVID-19 related to their economic and social circumstances. They are less likely to have health insurance, which reduces their ability and willingness to seek treatment. And on the other hand, African Americans with insurance are more likely to live in neighborhoods that have under-resourced clinics, emergency rooms, and hospitals. I live on the south side of Chicago, which is predominantly African American, and there were not a lot of services even for testing on the south side of Chicago in the beginning. There are more now, but it had taken a lot of time in order for those resources to make it to the South Side. So now what I'd like to do is share with you this quick clip from this video, which comes from a Natural Causes, a California newsreel and PBS. And it's really just going to share or show how these issues impact and how where you live and the social determinants of health can have an impact on your health. And start back. Hopefully you were able to watch the video. And in the video, it pretty much sort of displayed how living in disadvantaged communities can cause challenges for your health. And I did see in the questions box, thank you for the comment, that many African Americans are working in essential jobs and could not work from home, which is absolutely true, which means that they were putting themselves more at risk for contracting COVID-19. And not speaking so much about our healthcare employees, but a lot of our citizens who work in transportation services and food service and places like that, where they didn't have protective equipment or masks in the beginning and were sort of just open to the elements of the environment, which could have an impact also on the health stats. So I have to also bring up the concept and the fact of racial trauma. Because as we think about different forms of trauma, whether this is historical trauma, complex trauma, acute trauma, or system-induced trauma, there are a lot of different types. At this day and age, more people are talking about race and issues pertaining to race as well as racial trauma, especially after the video of the death of George Floyd went viral and many people were able to see it, which actually induced what we call secondary traumatic stress for a lot of people. So here's a few quotes. Dr. Ed McDonald, who's a Black physician at the University of Chicago Medicine, in a recent article on MedPage today on June 8th, from citing this 2018 study from The Lancet, said that when a shooting of an unarmed African American is publicized in the media, it has a spillover effect on the mental health of that community. So it's a communal sort of experience of this secondary traumatic stress that happens, and even though it didn't directly happen to an individual, just from seeing it causes a traumatic stress response. When I looked at the 2018 study from The Lancet, I also learned that police kill more than 300 Black Americans, at least a quarter of them unarmed, each year in the United States. Another statistic, that around 2.2 Black men per 100,000 die from police violence, which is more than the number of people who die from certain forms of E. coli each year. So what we're dealing with is COVID-19, which is a pandemic, but also sort of the issues of racism in our society and how that impacts people of color, specifically African Americans. Or I should say specifically Black Americans, because not everybody who identifies as a Black American identifies as an African American, depending on their ancestry. So when we think about the perception of threat, that's what can cause us to have stress. With a normal brain, as you can see in these brain scans, there's lessened activity of the basal ganglia, and a high anxiety brain has increased basal ganglia activity, meaning there's more sense of vigilance and more sense of being, of existing in their fight or flight response and continuing to move forward from a traumatized state. Now, when this is chronic, then it causes our bodies to release extra amounts of cortisol, which studies have shown contributes to chronic illnesses versus being able to move forward in more of a relaxed state. So let's get into some of the skill building. How do we get in the know about how you and others see the world? Well, there's one train of thought that says if I immerse myself fully within a culture, then I'll understand everything about that culture in order to work with people from that culture. While that might be true, there is not enough time in life for us to immerse ourselves in every culture. Therefore, the approach that I like to use is the approach of developing skills at discerning cultural perspectives, your own worldview, as well as the worldview of others. So, that brings me to the CLARE method, which is a tool for cross-cultural communication. The handouts that are listed in the bottom of the left panel, one of them is a handout that describes the CLARE method, and I'll briefly describe it for you as well. The second handout is that of a role play form that I'm going to invite you to use while we're in this webinar today. But before I get you to that point, let me first go over the CLARE method. It comes from the nonviolent conflict resolution theory. So think about people like Gandhi or Martin Luther King or Dorothy Day, individuals that use tools like this during moments of real adversity. So the idea is that if someone says something that challenges my worldview or the way that I make sense of the world, or that induces stress in me, then I naturally will move into my fight or flight response. Okay? The reason that happens is that our bodies do not know the difference between a real threat and a perceived threat. Physiologically, we have the same response to both. Now, I need my fight or flight response if, for example, I'm being chased by a dog. But I don't need my fight or flight response if I'm having a challenging moment with a colleague or coworker and we disagree, or a challenging moment with a patient or client and we disagree. I also don't need my fight or flight response if I get an email from my boss that says I need to see you in my office. But I'm still going to have the same physiological response as if I was being chased by a dog. So the first step of the CLARE method is for us to calm ourselves, find our centers, check our pulse, and take a deep breath. What we do when we relax our bodies, it's giving us an opportunity to relax our minds. Because if I'm in my fight or flight response, then I tend to be very reactive to my environment versus proactive. If I'm a leader and I'm in my fight or flight response, I may have a tendency to be more coercive with my leadership than being transformative. So when we relax our body, we actually within seconds regain that neocortical functioning in our prefrontal lobe, which is the part of my brain that helps me to think of consequences of my actions. It helps me to problem solve. It helps me to tap into compassion. It helps me to increase my ability to speak and language abilities. It helps me to do all of the things that I might need to do if I'm having a challenging moment with a colleague, coworker, patient, client, or if I need to go and see my boss who sent me an email saying I need to see you in my office. So it's important for us to relax our bodies because when we're not in a relaxed state, we're in a sympathetic dominant nervous system, our fight or flight response. When we relax, breathe, try practicing our diaphragmatic breathing. Try practicing being mindful. Whatever tactic or tool you use to relax yourself, whether that's count to 10, then you move from a sympathetic dominant nervous system to a parasympathetic dominant nervous system. And you're able to regain that neocortical function. If we don't self-regulate, that's what this is about, calming ourselves and self-regulating our bodies, then it's as if we are the analogy I use is gunning the engine of our car. If you are in your car and you're on the highway and you gun the engine all the way to your destination, let's say your destination is 2 hours away, the car may not make it and it may break down on the side of the road. But when you take your foot off of the gas pedal every so often and allow the car to recalibrate, That's the same as if we, or similar to, or analogous, I should say, if we are relaxing our bodies and giving our bodies an opportunity to self regulate instead of moving forward in a threat response or traumatized state. Okay, so after we calm and find our centers, then we're better able to listen to the other person's perception of the problem. And listening actively, meaning I'm listening intently to what you're saying and not trying to formulate my response while you're speaking. It's important for us to calm ourselves and find our centers so that we can better listen in an effort to do the next step, which is sometimes the most difficult step. We are to affirm some component of the speaker's perspective. Now notice that this says affirm, not agree, which means that if I practice this tool, I should be able to affirm you even when I disagree with you. It also says affirm and not apologize. I think sometimes we apologize to people to appease them, but we really have no reason to apologize because we perhaps haven't done anything wrong. So with this tool, it's important to think about how we can affirm the humanity of the other person or a piece of their perspective. In compassion theory, the theory is that all of us hold a piece of the truth. So if we're listening intently to another person, even when we disagree with them, we may be able to affirm a piece of their humanity or a piece of their truth. And we do these first 3 steps before we respond to what was said and before we add information to the response in a way that moves the discussion forward.
Mute off.
Are you hearing me? Okay. I don't know how much of you missed. I'm sorry. But I'm going through the Claire method. Don't worry. We'll get a chance to practice it. So the important thing is that we practice these first 3 steps of the Claire method before we move into responding and adding information. And I spent quite a bit of time explaining the first 3 letters. I hope you were able to hear me. But the reason that I spent so much time on those first 3 and not the last 2 is because these last 2 steps are what we do all the time. Okay? Someone says something, we respond to what was said, and then we add information to support our response. And then they respond and they add information. Before we know it, we're having an argument and not having a dialogue. So I think it's important to try to practice these first 3 steps before we could, okay, great. It's important to practice these first 3 steps before we respond and add information. But there's one more important thing to remember. It's very important that we do not use the terms but and however when we are making an affirmation. Because if I use but or however is a fancy but, other fancy buts are like that said, nevertheless, then we kind of completely negate everything we said before we use the but or the fancy buts. So consider using connecting words like and, in addition, also, at the same time. Because it's sort of like saying, I can imagine how you feel that way. But if you could just suspend your way of thinking and join my worldview, then your life will be a lot better. Instead of doing that, it's saying, I can imagine how you feel about what just happened. At the same time, this is what I think might have happened. It's holding them both at equal footing. It's not saying that what I have to say is better than what you have to say, nor what you have to say is better than what I have to say. Okay? Now keep in mind that this is a practice within what I like to call your own spiritual gym, which means that this tool is not actually about the other person. It's about you and how you choose to show up during an encounter and how you choose to maintain your character, your integrity, and your sense of self, even if the other person is having a challenging moment. This is a tool to use for trauma-informed care or resilience-based care because we have to take care of ourselves. And I don't want to be drawn out of character and be shown in a light that's less than positive because I was triggered or challenged in terms of my way of making sense of the world. Okay? That being stated, keep in mind that the CLARA method is not going to always go perfectly CLARA complete. Quite frankly, it may go CLARARARALCLACCCCCCCCCCCCCCC because it's a practice in your spiritual gym. And it's about how you choose to show up during the encounter. Okay, so I will give you an example, and then I'm going to give you about 5 minutes to work on your own example individually, maybe using the handout number 2. It might be number 1, but I think it's number 2, the role play sheet. So here's an example. If someone came to me and said, Joel, I do not think that now is a good time to have a diversity and inclusion initiative. I think that those resources could be used better elsewhere to help improve the patient experience. First thing that I'm going to do is breathe to find my center. Now I'm listening to what the other person is saying. What I hear them saying is that they've been thinking about the place of diversity and inclusion, and they said something about wanting to improve the patient experience. Those are things that I might actually be able to affirm, even though I don't agree with what the person's saying. So my affirmation may sound something like this. Wow, it seems that you've given it quite a bit of thought about the place of a diversity and inclusion initiative within this organization. And I get that because I've given it quite a bit of thought as well. In fact, I appreciate your desire to want to improve the patient experience, because again, that's something that I'm interested in also. That's my affirmation. Now I can respond. And my response simply is, and I disagree. Then I can add to the response any of the information that I feel that would be helpful for the other person to consider, maybe giving them something else to think about, like improving our diversity and inclusion helps to improve our cross-cultural communication skills. And when we improve our communication with each other and with our patients or clients, they have a higher level of satisfaction with the care they're receiving because they have a better understanding of what's expected of them when they go home to follow their health routines. And if they do, they feel better about what we're talking to them and agreeing upon, they may have a better chance of adhering to the home health routines, which may improve their health outcomes, which could also perhaps reduce readmission rates, especially if I'm speaking to someone who's interested in the bottom line. Then I can discuss how it can actually help with with the bottom line, with finances. Or I could talk about how it's abiding by the laws, the city, the state, or the federal laws. Or if your organization is accredited by the Joint Commission or CMS, there are plenty of standards around non-discrimination and effective communication with those as well. So there are many pieces within the business case for why diversity and inclusion is important. But again, I did all of that after practicing the first 3 steps. Okay, so why don't you go ahead and try to take a few minutes, I'm going to give you about 5 minutes, to think about a situation or scenario with a coworker, colleague, or a patient or client that may challenge you. How will you apply the CLARA method? First, think what tactic you will use to calm yourself and find your center. That's what you would write in the first box. Then, as you're listening to what was said or what the situation is, listen to the words that are spoken as well as the words that are not spoken. Because we have a tendency to speak about what we think, but not actually name how we feel. And sometimes the only place to affirm someone is in their emotion, because we're all human, so we should be in tune with our emotions. So if someone's frustrated or they're upset or they're angry, then maybe when I start to affirm them, even if I disagree, I can say, I can imagine how frustrating that must feel. Or I can imagine how upsetting that must be. I find that it's very difficult for someone to argue with my imagination, so I tend to start off with that. I don't tend to say I understand, because that in itself can trigger the other person to say, you don't understand me, you don't understand my life, you haven't walked a mile in my shoes, right? But it's hard for someone to argue with my imagination. So it's often safe to start an affirmation off with that. Those are the first three steps that I really want you to practice. We don't have to practice the R and the second A, because again, those are things we do all the time. And a place that you may want to consider practicing this method is in written communications. In fact, the next time that you're going to respond to an email, I encourage you to type the email the way you normally would, go back and read through it, see how many times you use the words but, however, nevertheless, that being said, or any of the other fancy buts. Take them out and replace them with and, in addition, also, or at the same time. And then go back and read the message again, and you will see the whole spirit of the email communication will have changed. If you're working individually, I'll give you about 1 more minute. Oh, thank you for sharing that, Penelope. And thank you, everybody who let me know that you could hear me the whole time. I'm so glad. All right, let's move on. Actually, we have about 8 minutes left to our time together. So now would be a good time to put questions in the question box. Even if you asked the question earlier, I may have missed it. And so maybe retype the question. And it can be pertaining to anything that I discussed in the webinar today. Or even if you have a question that you think that I might be able to help answer or point you into the right direction. I agree. I really love the Clara method. In fact, and I'll just put it back on the screen. I try to very much practice what it is that I teach to people. And there are times, I must admit, that I don't engage in using the Clara method tool. In those moments, it's like I even think to myself, I should be using the Clara method. And it's like I can see the train wreck coming, and sure enough, it crashes, and the outcome is nothing like I really would have wanted it to be. The good thing about the Clara method tool is that it can also be used for service recovery, meaning I can take a moment and regather myself and then come back to the same person or situation and try to use the Clara method then as a tool for recovery. So my recommendation to approach extremely difficult people resistant to any change. First thing I want to say is I only practice this tool when I can assume good intent in the other person. If I cannot assume that this person is invested in building the relationship, then this may not be the tool to use, and I might have to authorize myself not to participate in the conversation as my way of protesting the conversation. Though people like Martin Luther King used this tool even during moments when they were in real threat and danger. I'm not encouraging you to do that. You use it at your own will, because there are appropriate times to authorize ourselves to not engage. Will this be taped training for on-demand viewing? I don't know. That's really a question more for Joanne and Carrie. Feel free to come on and answer if this will be taped or type your response. The source for the Claire method is at the bottom of this slide. You originally I learned Lara, which is contributed by Love Makes a Family Incorporated. The C step was added later, and that's attributed to the Nonviolent Peace Force. Okay, I'm glad that you can find this helpful and good to help even with clients. Um, I have observed that communication becomes most difficult when discussing things we are passionate about or that threaten our worldview. I love the Claire method, but what suggestions do you have to train yourself to take that first step to calm, center, and breathe, especially when we feel emotionally triggered? So the thing about the Claire method is there's no wrong way to practice it. For some of us, we may need to first just practice the first step. Practice learning how to calm ourselves and find our centers. One of the things that I think can be helpful when doing that is if we can remember the promise that we made to ourselves in terms of how we want to be in the world. Again, operating from your own moral code. If I can think about my personal promise of how I want to show up during an encounter, then that can help me remember to breathe and relax my body so that I can better relax my mind and respond. Or I may need to use it just as a delaying tactic to give me a little more time to collect my thoughts and to manage my emotions. I might have to first say, that's an interesting statement that you made. And I do have a response, but just please give me a few minutes before I can respond. I have to take care of something else real quick. Then I move, and what I have to take care of real quick is myself. So I can find my center and then come back and re-engage into the conversation. How about if it takes a little more time to become calm? Like I said, you can try using a delaying tactic, or depending on the situation, you may be able to ask the person to agree to pick the conversation back up at a later time or on another day or something like that. But try to use a delaying tactic so that you don't just completely leave the conversation, especially if you want to build the relationship and you think the other person wants to build the relationship as well. Try to engage in a delaying tactic. Thank you for all of the compliments. I see them and I appreciate it. How can I, as a woman of color, navigate the conversation about race and racism when white fragility shows up in the space and affect my own mental state? Okay, good question. I think that it's important. First, we have to work with people like us sometimes for support. Meaning, as a person of color, I may need to engage with other people of color so that I can have support around navigating through the everyday stresses of life, right? And then I work with people who are different from me for the purposes of coalescing and trying to make real structural change in the world, right? So if I'm in this situation, again, I would have to authorize myself to disengage because there are a lot of people, black, white, brown, whatever race or nationality or ethnicity you would think of, that have been doing work around anti-racism for many, many years. So the information is there. So sometimes maybe what I'll do is I'll refer them perhaps to Peggy McIntosh's Unpacking the Invisible Knapsack or another white individual who has done a lot of work around anti-racism and helping people learn about white privilege. It's no different from when I was a part of RAVEN, which is an organization in St. Louis, Missouri, that stands for Rape and Violence Ends Now, which is an organization that focuses on men and male privilege and what it is that we can do within our authority and power to try to help curb violence against women instead of blaming victims and saying that they need to do something different about how they're living. So sometimes we have to encourage people to find mentors or guides of their own identity group to help them learn. Yes, I offer other trainings. Um, oh, don't forget to put this in the action box. I'm sorry, it's 6:30. If you would like to reach out to me, just simply reach out to me through my email address. I'll give you my work email. I'm sorry about the loud clicks of my keyboard. And feel free to email me here. Oh, thank you, Joel. I love your name too. Okay, I guess that brings me to the end, and I'm sorry that we've gone 1 minute over. I'll turn it back. Oh, there's my email address. I'll turn it back over to you, Carrie, if you have some final remarks you'd like to make.
Great. Yes, thank you. Thank you, Joel, for the great presentation and the wonderful tools and resources that we can take away and use in the work that we do. Thank you to all the participants. As we come to the close, we want to just leave you with some upcoming learning opportunities. We're going to be continuing this learning and offering an implicit bias in mental health series that's now until late August. So feel free to view the recording of the first session, register for upcoming sessions. We will be offering CEUs for those particular webinars. And then we also have a session on telehealth that will be July 20th, and we'll be posting up some additional sessions on the topic of suicide prevention. If you missed a previous webinar and want to watch it again, especially this one, we will be posting those archived recordings to our website. You'll see the link there on your screen. You can go to our products and resource catalog to find that. Joanne will be sending out a certificate of completion to those who participated online. If you happen to join just by the phone, if you want to email Joanne and let her know you were on and need a certificate of completion, she'll be happy to send that your way. Here's our contact information for the Pacific Southwest MHTTC. You can follow us on social media, join our newsletter. And again, we just want to say a huge thank you to our presenter, Joel Jackson, to all of you for your participation. If you can please take the short survey that will pop up on your screen. We really value your feedback, and it helps us to provide trainings and resources to you at no cost. So again, just thank you all. Thank you, Joel. I hope you enjoy the rest of your day, the rest of your evening, and
Thank
goodbye
you,
to
everyone.
everyone.
Goodbye. Be well and take good care of yourselves.